Hello, future healthcare professionals. Um, Today we're going to talk about give an overview of the integumentary system. We're going to look at, subjective and objective data that you're going to collect as nurses and understand that assessing skin kind of communicates our overall health. Um, So it gives us a lot of information on our patients. So when we're talking about the assessment itself, you know, like I said, we're going to talk about subjective data and we're going to ask questions about our clients' self-care behaviors, any kind of medications they are taking or using on the skin, any kind of environmental exposures or occupational exposures. Where do they work? Are they exposed to any kind of toxic substances or something? Um, you're going to ask them, have you had any changes in your color of your skin? Have you noticed any lesions? And all of this kind of helps us gather up the evidence that we need to understand what's going on with our patient's health at the time of our assessment. And then we move on to the objective data. So objective data, we as nurses are going to be assessing for the color of the skin, the temperature of the skin, the moisture. Is it excessively dry? The skin turgor, the texture, um, uh, any signs and symptoms of bruising, itching, or rash. We're going to look for hair loss, nail health like pitting, clubbing. So all of this is going to give us some idea of the patient's status. Um, as we go in more depth of the skin assessment, we may have to use like a magnifier. We may have to use light, maybe shine more light to a certain area. We may have to use, they have something called a Woods lamp, which is an ultraviolet light, just to kind of help us, see what's going on with the skin, because we're using our naked eye, right? And then also with these tools, we're assessing for any kind of scars on the skin, birthmarks. We are looking for edema and capillary refill. We're looking for capillary refill also when we're looking at those nail beds. Um, Cultural considerations. Usually, we're going to come into contact with people with darker skin, and and that assessment will be a little bit different because when you're looking for cyanosis, the cyanosis on the lips and the tongue, may look more gray. The nail beds, the soles of the feet, the palms of the hand may look more bluish in color. Jaundice, that yellowing, we may have to look at the conjunctiva of the eye. Um, and so that'll kind of, they may be different in it may be different from one patient to another. So it's crucial to look at these things, crucial to look at, like I said, the lips, the tongue, the nail beds, the soles, the palms, uh, and then the conjunctiva for subtle signs. It could be something you may have a patient and you're looking at them and you've looked at them and they look fine. And then you can be walking out the door after you've given discharge instructions and you turn back and then they're looking at you and their eyes are turned. And if you look at them, you may say, oh, you see that hint of that yellowish. You yell, and then you call the provider and say, hey, something's going on with my patient. Um, Also, when you're looking at skin, you're going to be assessing for any kind of bleeding. So we're going to be looking for any kind of swelling or darkening to the skin. And of course, you're going to always compare one side to the other in any kind of assessment. Also inflammation, any warm erythema, so the redness of the skin. You're going to see if the skin is shiny or taut, or pitting. So all of these things, you're going to be looking for and assessing. And like I said, you're going to be assessing one side, the unaffected side to the affected side to note the differences and the similarities. Okay. Let's see. With teaching, you know, um, we're going to have to, of course, nurses, we have to educate our patients. So with educating, we're going to have to educate them on avoiding harmful factors that can affect our skin, like skin exposure, sun exposure, making sure they use sunscreen, do techniques for, protecting the skin from the sun. Okay. Then also, we're going to have to teach and encourage our patients to do like self skin examinations. Looking, they have something called the ABCDE method, looking for any abnormalities in the skin. So, is the skin, is there any asymmetry? Are there any border irregularity? Has the color of the skin changed? Is there a lesion or something that's greater than 6 millimeters in diameter? So has the size changed? Is the shape, we talked about irregular borders, has the shape changed? So we're going to have to learn these techniques and then also teach our patient these techniques. Um, you know, Understanding that this skin assessment is really just a gateway. It's another way of understanding our patient's health. And we gain lots of insight. And also, these assessments kind of guide our plan of care through these meticulous evaluations that we do on our patients as nurses. So, in conclusion, thank you for diving into this overview of the integumentary system. Um, and as future nurses, understand that your detail to skin evaluation is really pivotal and comprehensive and I guess compassionate, care that we have. So best luck on your journey. Until next time, see you.